Baby shark, I can still hear you call through the waves and through the hall. Mama's voice was a guiding star. Now I'm singing to the dark afar. Daddy shark, so strong, so kind, held my hand when the sun would shine. But the tide took him away one night, and the moon just watched me cry.
Check mic 1 2 2 1 2 mic check. Check mic 1 2. Check 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 mic 1 2 1 2 mic check.
Every note of memory wave, every line, a name I crave. The ocean's cold, but it's home to me. I still hear that melody, like a ghost set free from a child I'll never be. Oh, the sea remembers all the songs we used to sing. Now the waves call my name, and I'm ready to begin again. Some songs grow, but they Once I sang this land to the sea, and the sea sang back to me. Baby shark, I can still hear you call through the waves and through the hall. Mama's voice was a guiding star. Now I'm singing to the dark afar. Daddy shark, so strong, so kind, held my hand when the sun would shine. But the tide took him away one night, and the moon just watched me cry. Baby shark, you still swim in my heart. Oh, mama, I can hear you in the wave, family of the sea. Remember me. Oh, can you hear me singing? I grew old, but the song remained.
Good evening, everyone. Good evening, everybody. Please, I want to see smiley faces. Are you not happy to be here? Okay, welcome, everybody. Welcome you to Mom Fertility Clinic. We're going to be taking our opening prayer now. Please, can you take our prayer, Tina?
In Jesus' name. In Jesus' name. God, we thank you for your mercy. Thank you for everything you have done in our life and that of our family. Father, we see your name be exalted in Jesus' name. Thank you for bringing here safely. Thank you for everything you're going to do here today. Father, guide us and protect us in Jesus' name. Today will be successful in the name of Jesus. In Jesus' name I pray.
Thank you very much. We all look good today. A round of applause for yourselves, please. Okay, well, welcome to our A to Z of assisted conception. And our theme today is from diagnosis to decision, navigating infertility as a couple. We all know that infertility does not discriminate, and it affects individuals, it affects families, it affects homes without warning. Yet access to fertility remains expensive with no free government coverage and limited HMO support. Circle Mom Fertility Foundation was created to bridge this gap, reducing financial burden of fertility and assisted reproductive treatment and giving hopeful parents a rich chance at building their families. Our mission for Circle Mom Fertility Foundation is to support individuals and couples experiencing infertility by providing access to free and subsidized IVF treatment, building partnerships with reproductive health providers, advancing public reproductive health providers, advancing public education on fertility, and championing policies that promote reproductive equity across Nigeria, Africa, global fertility ecosystem. And our vision is to catalyze a future in which infertility ceases to be a barrier to the realization of parenthood through the promotion of equitable, dignified, and sustainable access to advanced reproductive technology. Our founder is Dr. Charles Ojabo, and the co-founder is Barrister Victoria Ojabo. Please, a round of applause for them. We've seen a lot that Circle Mom Fertility is doing for couples, and we can say for a fact that this foundation is doing well. Please, another round of applause for the foundation. Okay, with no further ado, I think we should go into the business of the day. And we'll be introducing our speakers for today. We have a very good man, a seasoned doctor, the MD of Mom Fertility Clinic, the founder of Circle Mom Fertility Foundation, Dr. Charles Ojabo.
Dr. Charles Oyabuo is a highly respected medical doctor and clinical embryologist with over a decade of expertise in assisted reproductive technology. As the medical director of Mom Fertility Clinic, he has become a leading architect of new beginnings, helping countless couples achieve parenthood through IVF and surrogacy. Driven by a heart for service, he is the founder of the Circle Mom Fertility Foundation, where he provides free IVF cycles to couples in need, and the co-founder of Mothers of Faith International Ministry, offering spiritual strength to those in their season of waiting.
Please join me and welcome Dr. Charles Ojabo. Thank you, sir. And our second speaker for today is a wonderful woman, a beautiful woman, the co-founder of Circle Mom Fertility Foundation. She is no other than Barrister Victoria Ojabo.
Victoria Maria Oyabuo is a specialized family law lawyer, chartered mediator, and mental health counselor who provides a holistic shield for families. By bridging the gap between legal protection and emotional healing, she guides clients through the complexities of IVF, surrogacy, and adoption with unmatched grace. As the co-founder of both the Circle Mom Fertility Foundation and Mothers of Faith International Ministry, Victoria is a fierce advocate for the underprivileged and a compassionate voice for women navigating the journey to motherhood.
Please, let's welcome Barrister Victoria Ojabo. A round of applause for them again. And also, do you know that they're husband and wife? And they're doing this. Please, a round of applause for them again. Thank you very much, sir. Thank you very much, Ma. Welcome to the show for today. Okay.
Thank you very much.
Our topic today is from diagnosis to decisions, navigating fertility as a couple. We all know what infertility is. And we have a scenario whereby young people, even advanced people, they get married, they fall in love, people are happy, families are happy. Oh, our son, our daughter, they are getting married. And they get married, have a glamorous wedding, everything is going well. 1 year, 2 years, 3 years down the line, people are asking, mother-in-law is asking, Haba, how far your wife now? People are asking the husband, what's up? What's happening? They're asking the daughter, is your husband not doing well? People are questioning them. Things are happening. A lot is going through their mind. And they don't know what to do. They come to see people, they're just worried. So, Dr. Charles, at what point do you think couples should stop waiting and seek medical help?
Thank you very much for that question. Waiting, trying to conceive can be very burdensome. It can be, patients can go through this phase with a lot of trauma, and of course there's hopes. But the question is, how long should you wait before you now seek help? For a woman who is under the age of 35 years old, okay, and she's been trying to conceive, having regular unprotected sexual intercourse with her partner, and she's not been able to achieve pregnancy for 12 months, she should seek, if the woman is above the age of 35 and she's trying to conceive and she's having regular unprotected sexual intercourse with her partner and she's not been able to achieve pregnancy in 6 months, she needs to seek medical advice. Okay, but there are some patients that, okay, yeah, it may not be age factor, because in fertility, the age of 35 is a very important milestone, where from the age of 35, the woman's fertility potential begins to drop rapidly. So that's why it's a dividing line. You are less than 35, you want to seek help. Once you're trying for 1 year, you're above 35, you're trying for 6 months, you also want to seek help. But there are some people who they have some pre-existing medical conditions, like a woman who is not seeing her period regularly. You don't want to start trying for so long. You just want to seek help. You've had history of pelvic inflammatory disease, from maybe sexually transmitted infection. You have been treated, and you know maybe you may be suspecting something is wrong, or you are not even seeing sign of ovulation. You know, you are suspecting. You don't need to wait that long anymore. Or you've had a scan and they told you that there's fibroid, and now you are married and you want to conceive. You don't need to wait. So seeking help on time can be very helpful in terms of the woman's biological clock, because she has a time frame where she needs to where her egg quantity and quality are still at their at its optimal. Okay, so you want to seek help on time. You know, a lot of people will say, I want to wait. That there is no point waiting for so long when God Himself has given us the knowledge to assisted conception.
Thank you so much, sir, for that. Okay. So we have a scenario where young ladies, they get married, they are virgins. Their partners are also virgins too, and they get married and there's nothing happening. They're waiting for children, nothing, and they're questioning themselves. I've been good. I kept myself till I got married. What can this couple do in this situation?
Okay, well, it's a very good question. I get that a lot. Doctor, I kept myself. There was nothing I didn't do. I went to church and everything. Why am I suffering? My friends that were just everywhere, they have 5 children. They are even trying not to, they are even tying their wombs, their fallopian tubes. They don't want to conceive again. Doctor, what is the problem? And the thing is, being a virgin doesn't necessarily mean that other causes of infertility may not be existing. Like, for example, fibroid doesn't know whether you're a virgin or not. And if fibroid is overwhelming, it can cause infertility. Some women can have polycystic ovarian syndrome. That means they are not ovulating every month. Okay, it has nothing to do with that you're a virgin. Also, some of these obstetric issues can come up in a woman who is a virgin, yet she's having infertility issues.
Okay.
It shouldn't be so, but being a virgin kind of rule out some certain causes of female infertility, like pelvic inflammatory disease, because she's not exposed sexually, so she's not at risk of infection, she's not at risk of a blocked fallopian tube. Yes, but there's other causes of female factor infertility that doesn't selectively decide whether it comes in whether you are a virgin or not. So the concept of virginity is just when you first have intercourse. Okay, whether you're having it as a teenager or you're having it in marriage, it's just, that's just the concept. However, infertility, female factors or there are other factors that can drive in for a woman who is also a virgin.
Thank you so much, doctor. Doctor, people often blame the woman that she's the reason for them being infertile. Some people, I don't know if they expect, okay, because they feel the woman is the one carrying the baby, so she's the one that has the whole issue. They don't, Nigerians, the world, people don't really blame the men. Is it that infertility is a female problem? We want to know, is it a female problem or not?
Well, I don't think infertility is a female problem.
Okay.
It's a couple medical condition. Okay.
Please, I think we should take note of that. Infertility is a couple medical condition, not a female problem. Please.
It will surprise you that infertility has contributory factors. If we look at male factor, for instance, it contributes about 30 to 40% of infertility that couple experience. Female factor, infertility, contributes also 30 to 40%. Are they not equal? So 50% male, 50% female. And you see some couple, they may not have just only male factor or female factor. They may have both male factor and female factor. Those account for about 10 to 20% of couples. And there are this group that the man is okay, the woman is okay. Nothing is wrong, unexplained.
Okay.
In Africa, they'll say spiritual. It's 10 to 15, 10 to 20% also contributing to infertility.
Okay.
So it's not really a woman's thing. It cuts across husband and wife. So you need evaluation to know what is the issue. For men, it could be low sperm count called oligospermia. Sperm count less than 16 million per mil. Okay? The concentration is low. Now, you need a lot of sperms to go and fertilize the egg. So they are not enough to go to reach their final destination. That can be a cause of infertility. For example, motility, okay? Also known as motility issues. You have the sperms are not moving forward because they are sent on an assignment. They have to go forward, go into the egg, fertilize that egg. Okay, a sperm has to fertilize that egg. If the sperms are doing about, turn, roundabout, left, right, they are not going forward, they won't get the job done. And that can be a cause, also known as astenosospermia. Then there is also morphology problem. The way sperms are, they look like baby frog. How many of you know baby frog? Tadpoles. Do you know baby frogs? Tadpoles? So it has a head, the tail for the tadpoles. Then the sperms, they have the neck piece and the tail and the head as well. So that's how the sperms are supposed to be. It's supposed to look normal. Normal head, normal neck piece, normal tail. But you see some men, they may exhibit two heads, two tails, long tail, no tail. How will the sperm fertilize the egg without a tail? So these are issues that men have, but nobody talks about it. Hormonal imbalance in men. Do you know that men have hormonal imbalance? Yes. Lifestyle. They take a lot of alcohol, smoke cigarette, marijuana. These are things that constitute free radicals and cause oxidative stress to the sperms. The sperms, they look normal. This man probably doesn't have oligospermia, no low sperm count, no motility problem. Nothing is wrong. The sperms, they look normal. But inside the DNA of the sperm, there is fragmentation. So the man may not be able to fertilize and have embryos that are quality good enough for implantation to occur. So there are also female factor infertility, tubal factor, maybe blocked fallopian tube. There are many fibroids overwhelming the reproductive tract. There is sexually transmitted infection leading to pelvic inflammatory disease. The woman is having pains, and that can cause infertility. Yeah, so both female and male can contribute to infertility and not necessarily the woman alone. So it's a couple medical condition that needs evaluation and a proper treatment will follow after.
Thank you so much, Dr. Charles.
Thank you.
Barrister Victoria, when couples hear there's a fertility challenge, they are worried, they're troubled. So many things are going through their mind. The woman, the man, nobody knows what to do. What usually happens to this couple emotionally?
Okay, thank you very much, Benedicta. Good evening, House. So the topic today, from decision to diagnosis, this topic is actually very pregnant. There's a lot. We can't even exhaust it. Now, a scenario you gave, a boy meets girl, they fall in love. Let's say they even met from university. They've been in love. They're looking forward to getting married. They finally get married, and they are waiting. The wait is not 1 month. We're talking about 1 year. Some 2 years, some 5 years, some 10 years, some 15 years is a long time to wait. The first thing that comes to mind is denial. All right?
Okay.
This is not our reality. We've gone to church. They've told us that we'll have twins. You are in the prayer meetings, you're in the Bible study, you're in the prophet's house, you're in support groups. These and more happens to this woman or this man. And trust me, the men feel same way. There's nothing like the woman is the one feeling the weight more. Just that men have a different way. Research has shown that men have a different way to handle it. So infertility counseling is called the 4-phase model. Okay? So today I'm speaking both as, I'm wearing two hats today. I'm speaking both as a fertility counselor, mental health counselor, and a lawyer. Okay? So in fertility counseling, they call it the four-phase model. The first model speaks about realization. Okay, now there's a problem. You go to church, the people you got married together, they are holding not only one, they're holding two, they're holding three, and you're asking yourself, ha. Then everybody's like, how far now? What's going on now? People are giving you numbers of doctors, giving you numbers of pastor. Everybody now realizes that, it's like something is, and even you as a couple, you say, we need to get help. You come out of the bubble you are in. You are no more in the bubble. You were saying, no, that's not our portion. The first year, second year. Then when you now see your colleagues or people now make some kind of statements that infer you don't have a child yet, please give me my child back. When they start making those kind of statements, you now realize, the man now realizes, the woman now realizes we need to get help. So at the point of realization, there's an acknowledgement of self and even to others that the problem exists. And at the second phase, they begin to experience shock. They wake up at midnight and like, is this really my reality? Anger, outburst. There's a blame game. Oh, I lived a very good life. Like the example you gave, the virgin married to a man probably who is not a virgin. Maybe he was smoking too much. Maybe he wasted his youth. The lady too. Oh, maybe she did several D&Cs and all of that. And that may not even be the situation with them. There's also the feeling of envy. Now, when I say envy here, I mean you are seeing other people having children and they are inviting you for baby naming. It is, you're not a bad person. Okay? If you feel that way, she don't born. Yes, she has given birth. You are totally fine. You have that tint of, oh, I wish that was me. That is one strong thing that we see in the couples that go through this journey. And then we see self-pity as well. If somebody now said, my child is just scattering the house. He's just writing on the wall. Your own better now. Your own good now. I wish I get person where I go house, go meet. Those are conversations that we hear. And from there, after they have realized that there's an issue, we move on to the next phase of the cycle, which is investigation and diagnosis. The moment of truth. You have gone to see the doctor, you book the appointment, and then the doctor tells you, okay, I'll scan you, and then you have to run some blood work, do some tests. We'll tell you whether your egg reserve is high or low or this, whether your sperm motility is good, and you're coming for the review of results. I can assure you, most patients, as they are getting dressed to come for that review of results, they are just praying, God, please, let it not be me. They will tell the husband, they can't tell their husband, oh God, let the problem not be me. And the wife is like, let the problem not be me. So that happens a lot. So you see things like, can our challenge have a solution? Can we get solution? Can we get an answer to what we are going through? We see things like, mixed feelings. Especially when they now tell you your AMH is like a test we do to measure your ovarian reserve, right? For those of us who don't know, it's low. Even if we dig and try to get eggs, we may not get. I must use my egg. I will use my egg. And she's there. And then you go into the theater and you come out and you didn't get anything. That is a reality. Or they tell the man, oh yeah, go and produce. We want to do semen analysis. Go and produce. And he goes and nothing comes out. Or when the analysis is done, nothing is alive. These are some of the harsh realities of this journey. Okay, so the moment of truth, and then the treatment process now starts. For those who are able to financially bear the cost for IVF, we know that it's expensive, it's extensive, it's a lot on the pocket. When they finally start, the woman has to come several times for injections. And they will say, I feel so sore. Some of them are given on the tummy, some are given on the bum, and you're like, I'm in pain, but you have to do this. It's like Even the husband will say, just do it for us, baby. Just do it for us. She's going through all of this, So there's a lot actually that happens. And then the final stage is after the IVF treatment, we've done the embryo transfer, and we are waiting for the pregnancy test. Oh, those 2 weeks, the longest 2 weeks ever. You are waiting to see the result, and it's either it comes out positive or it may come out negative. Because IVF is not 100% guaranteed. So these are some of the feelings. This is how the emotional, struggle would be. I'm someone that would like to look at the challenges holistically. So I've research that has been done from the Imperial College London 2020 shares that 492 women have experienced within the 2020 year and beyond, or before 2020, had experienced early pregnancy loss, that is ectopic pregnancy and miscarriages. And within the 1 month period after that loss of pregnancy, 1 in 3 of them met criteria for post-traumatic stress. 1 in 4, that's 24%, met criteria for moderate to severe anxiety. And we have 1 in 10 women with serious symptoms of depression. Even when it was a negative result, they feel like there's a child that they lost.
Wow.
Yeah. They feel like they lost something. Even with a negative, you were never positive, but there's like, oh, I could have had a child, or I just lost a child. Especially when they see their menses, it's shocking. Further research, the most recent research that was done by Middlesex University, 2020, shows that IVF fails 75% of the time, but success rates vary depending on the woman's age, and also 83% of people feel sadness, they feel frustrated, oftentimes or some of the times, and 47% experience feelings of depression, 40% experience suicidal thoughts. So we try to make sure that patients are given a holistic fertility treatment, okay, in our center. We try to ensure that there's holistic, so that we let you know that this is what the outcome might be. We try to take you through the journey and say, okay, this is it. We are at this phase now. This is what you're going to expect. This is what you may see, and let you know what the outcomes could possibly be. So for men and women, what are some of the emotions they feel? Men, most of them don't even want to come for tests. Why is your husband? He's coming. He traveled. He will be back soon. Excuses A, B, C. There's always something they have to say. The men don't even want to show up at all. I'm fine. In fact, I gave somebody pregnancy when I was in university or primary school. They always have one thing to say. They don't want to show up for the test. So you find men distancing themselves. They lose self-control. They have a plan. Some good, some bad. Okay? And then the women are confrontational. They wanna solve the problem head on. I just want to move on with my life because they consider their biological clock. And then they try to seek social support, either from church, from a support group, from a prayer meeting. They always would like to see, or from a friend or family member. And women like to escape the conversation of children. So there's something we call in psychology escape or avoidance. We don't want to face that thing. We want to use something else to distract ourselves. So you see them neck deep into their career, or some even pause their lives. They don't want to look for a job. They don't want to do anything. They just want to be at home, and their only goal is how to get pregnant. So these are some of the emotions that we find, and these are some of the challenges that they face. Thank you.
Thank you so much, Barrister Victoria. You talked about so many emotions. There can be the mind playing with them, there can be blames, and you even said suicidal thoughts. I'm actually surprised that they have suicidal thoughts. That's a lot. How do you think this couple can protect their marriage during this period?
Okay, so Number one way to protect your marriage would be avoid blaming each other. I get to counsel a lot of patients, and they'll say, I'm okay. It's the man that is at fault. I'm even surprised. He's been on the supplement and nothing. They are blaming. So you are going to navigate infertility together, hand in hand. What did I say? Hand in hand. You can't do this journey alone. It takes two to make a baby. Okay? And one other thing to do is to attend appointments together. Attend your doctor's appointment together. Don't leave her alone. Don't say she will be fine. She's a strong woman, and all those kind of things. Attend your appointments together. Communicate honestly. This is one aspect that I sometimes think about. A man doesn't want the wife to know he has a problem. The woman doesn't want the man to know that her ovarian reserve is low, because that's the common one, or she has to do a fibroid surgery. So you see them trying to sneak around. I don't want him to know. I don't want her to know. Those things, they become dishonest to each other. So you need to change that as well. Also, you should seek counseling. Seek counseling from a professional. I don't mean just any random person who just is counseling office. A professional that is fully aware of infertility and how it can take a toll on the marriage, because is in three phases: as an individual, as a couple, and even in the relationship. Okay, so if you are going to really do this journey of navigating infertility, you need to get counseling as well. Then my last point for this question will be that you are partners and not opponents. Okay, you are partners and not opponents. You are not fighting a boxing match. There's no race. You are going to win and have your baby together. Thank you.
Thank you so much for that. I think we should reiterate what the barrister said, that couples are partners, they are not opponents. I think we should say that together, that we are partners and not opponents. Thank you very much. Doctor, so now we found out there's a problem. And this couple, they are looking for help. They need solutions. They need a baby. What treatment options do you think are valuable for this couple?
Okay, treatment options are tailored towards what the diagnosis is. First off is you need to seek help. Okay, that's the first step. She talked about realization, acceptance, and all those things. You need to realize that you need help, and that's why we are here as fertility specialists. Now, when you come, we will do investigations. We evaluate you to know where the problem or problems are. Okay? Then we believe that if we begin to tackle those problems, we will be able to achieve pregnancy.
Okay.
Not everybody needs IVF. If, for instance, a woman is not ovulating well, for instance, we can guide her on how to track, get her to do ultrasound scan so that we can monitor the growing follicle and know when she can have a timed intercourse with her husband.
Okay.
Some women are able to do luteinizing hormone surge, LH surge, urine test at home. That when it surges, when that result is sensitive as positive, it means that within 24 to 36 hours after that LH surge, she will ovulate an egg. So some women just need that kind of guidance and they'll be pregnant. Some people, they just need to cut down on their calories, carbonated drinks, chocolates. Some people just need to exercise.
Okay.
Some people just need to take supplements, as simple as supplements. They can improve the low sperm count, the poor motility, mild motility issues. I remember when I said motility, the sperms are not moving progressively, right? They can improve because men produce sperms. And also, women can also take supplements to improve their egg quality. So at that level, those are some of the basic things that people can do. Some women may need surgery if they have mild endometriosis, if they have endometriosis, mild to moderate, if they have fibroids that are overwhelming and it's distorting the endometrium, where the part of the womb where the baby is going to stay. So if that is the case, she might improve doing surgery.
Okay, sir.
If that doesn't fit that group of couple, maybe they say the sperm count is low to the point that okay, it's they would need maybe around 10 to 15 million sperms per male. Okay, it's low, but it's not too bad. They can go for IUI, intrauterine insemination. It's a process where the sperms, the woman is primed for ovulation, the sperms are prepared, and through the use of an intrauterine device, a catheter, the sperms are passed to her uterus, her womb, so that the journey for them to get to the egg is very short. Okay, so or close to the fallopian tube. That can just be a solution for a woman who has thick cervical mucus that is hostile to sperms. So instead of trying, because the sperms are dying, an IUI can just be the solution, intrauterine insemination. So, like I said, the woman probably has some level of good ovarian reserve also, okay, and she's also young. So, a woman who is 40 and above um, may not be a candidate for IUI because her ovarian reserve may not be adequate. Okay, so that's an option for those category of people.
I hope we're taking notes of this, please. Thank you.
So then IVF is another option. In vitro fertilization is a process whereby the woman body is prepared. Instead of ovulating one egg per month, she's stimulated to produce multiple eggs. Every recruited egg is given opportunity to become a matured egg. So she's taken to the theater under mild sedation. The eggs are then collected into a a tube. All right, this tube is passed to the embryologist and they pick out the eggs from the follicular fluid. Now the husband is then asked to produce semen. So the semen is produced and the semen is now prepared. Okay, in the embryology lab, the eggs are now mixed with the sperms. Now the sperms can find their way into the egg. Okay, so that is a means of assisted conception that can be a solution. Once those eggs are fertilized, they now become what they call embryos. The embryos are then returned back into her womb and she gets pregnant. Okay, now there are some people that need IVF. A man who has moderate to severe oligospermia, the sperm count is very low, or moderate to severe motility. The motility is very low, okay, far less than 10% motile sperms. A man that needs who has morphology issues, okay, may need IVF. Then there is another method of in vitro fertilization, which is called intracytoplasmic sperm injection. Now, it is not for all men. For example, if the man has severe low sperm count, maybe you are just seeing 2, 3, 4 sperms in the entire prepared sperm concentrate, that man may be assisted with that device, a machine that is able to hold the sperm and inject it into the egg directly to fertilize the egg. That is intracytoplasmic sperm injection. Okay. And some people have gotten pregnant with that. Okay? And there are other methods. Of course, the woman also will be can be assisted if she has passed the age where her ovarian reserve is very, very low, with a donor program, same as men. So there's also a provision for male and female gamete donation, as well as embryo donation. What am I trying to say? A man he produces his sperm. The andrologist checks. There is no sperm at all. He does it again. There is no sperm. If the man does hormonal profile and it says that the man is not producing sperm, or the options of getting sperms from the testes has been explored and there's still no sperm due to maybe a non-obstructive azoospermia, that means there's no sperm, that man can opt for a donor sperm.
Okay.
And there are a lot of ethical issues on that. Should a man accept donor sperm or not? Like she said, the couple, they have to agree that this is our option, we are going for it. Okay? Being open and transparent is not a bad thing. It's when you are doing it, I don't want my wife to know, you are secretive about it, then it becomes an issue. Okay? Because in the Bible, God, there was a biblical reflection of sperm donation where a man called Judah had 3 sons. His first son was called who sinned, and God took him out. Right? Before died, he was married to Tamar. Tamar needed to have children for her husband. Then he's late. So Judah, their father, Er's father, told his younger brother, Onan, to sleep with Tamar so that he can have children for his late brother, So there was an agreement. Judah, Tamar, and Onan agreed to a sperm donation program. Make sense? That was levirate marriage in the Bible days. They do that so that the person's name isn't extincted. Somebody's children come out of that arrangement. So what did Onan do? Or what did Onan do? He spilled the sperm on the floor, and because of that singular act of going against the agreement, God took him out. So was God part of the arrangement?
Yes.
Because there was an agreement. So sperm donation can be an option to help people solve their fertility problem.
Okay.
Also egg donation. A woman has reached the age of menopause, or ovarian reserve is low, she has premature ovarian insufficiency, or she has premature ovarian failure. Now she's not able, or a woman who was born without an ovary.
Is it possible?
Yes, congenital absent ovaries. Women are born without ovaries, even uteruses as well. So that can be a condition. Would she not now have a child? Would she now just be folding her arms and looking? Now, age can be an issue. So these are options available. Okay, there's also biblical reflection to egg donation, where Sarah told her maid Hagar to have children for Abraham and herself. Hagar was an egg donor in that kind of arrangement. Okay, and it was open. God was not against it, right? Otherwise, God would have punished Abraham, Sarah, Hagar, or Ishmael. Rather, God blessed Ishmael. That was an offspring from that arrangement. So it just tells you that if they do it together as open as possible, and they sign the necessary contract and they go ahead with the process, as long as they are doing it together, then there is nothing wrong with such arrangement.
Thank you.
There
Dr.
are other
Charles.
methods.
We'll get back to that. We'll get back to that. I would love to know more about other options. So, Barrister Victoria, there's always law binding us as human beings. So, we want to know, during this process of assisted conception, are there laws, are there legal guidance that this couple should abide or go through?
Thank you for that question. I must say, in Nigeria, we do not have a legal framework for assisted reproductive technology. I'll say that again.
Okay.
In Nigeria, we do not have a legal framework for assisted reproductive technology. However, there are other legislations, there are other laws that exist that encourages us to go ahead with our practice.
Okay.
For instance, the Constitution clearly states the right to family life, right to children, right to own properties and all of that. All of those are fundamental rights, right? But rights to start a family and to live as a family. So we know that family is father, mother, children. Am I correct? Primary school.
Yes.
So let's take a leaf from there. But for a couple, let's put it in context now. For a couple who is trying to grow their family, build a family, the first thing that should come to your mind uh, when you have come to that realization stage that we need to do something. We need to do something fast now. Time has come. You must first of all consider the fertility center you are using.
Okay.
Is it an accredited center? Is it an approved center? Do they have the CAC certifications? Do they have the regulatory? In Abuja, we use FEMC, right? Mm-hmm. The regulatory certifications, accreditations to do their practice. If it's for ART, we have an association, the Association for Reproductive Health, Fertility and Reproductive Health, AFRH. It's an association that that looks into the activities of our practice, okay, ART practice. There is no legal framework, but we have guidelines, and we follow international best practices. So you want to check. Oh, we do so type of pregnancy. We do so. You have to verify so that you don't get swindled by charlatans, okay? And then. Yeah, you need legal guidance from there. Okay? So from the moment you step into the IVF clinic, you meet with the doctor, depending on what your test is saying, your test result, because like he said, we give personalized fertility treatment plan based on what the cause of the infertility is. He will let you know. But before you even begin the treatment, you should know that you are supposed to sign contracts. Tell your neighbor contracts.
Contracts.
Yes. You should sign some forms, okay? According to the National Health Act, which is the regulatory framework for all health facilities in the country, 2024 National Health Act, it provides for the rights and obligations of users and of healthcare and personnel. So that particular section 20 up to section 30. Yeah, there are 10 sections in that, under that. So it states the rights of a patient. Patient has a right. Okay? So permit me to read the section. It says, a health service, it provides that a health service may not be provided to a user without user's informed consent. Okay? The patient must be given adequate information about their health status, the range of diagnostic procedure, treatment options available, the benefit, the risk, the cost, consequences of whatever option they take. Okay? And the patient also has a right to refuse treatment.
Oh, they do?
Yes, they do.
Okay.
So what is the implication of that section? It means that there should be evidence that I, as a practitioner, I have done my part. So the next thing to do is to make sure my own evidence as a hospital or my own evidence as a fertility center is to make sure that consent forms are given. Okay? So, for instance, we're going to, a man and a woman walks in, they want to do IVF. Is a self-patient. She's using her own gametes. He's using his own gametes. We don't just take them into the theater and just start harvesting eggs and the man just giving us his sample, go and walk. No, that's not how it should be. We should explain the process. Okay. This is not just an SOP for the hospital. This is a national act. This is a national law. Okay? We should explain the process. Let them know this is what you're going to do. This is what you're going to do. And it should be reduced in writing. We are not gisting. We are not just gisting. No, it should be in writing. Okay? And then they'll sign the dotted lines and say, okay, please take me in, and take my eggs, or take my. You understand what I mean? Also, when the diagnosis has been looked into, and the couple need to use donor gametes. Doctor has already talked about using a donor, whether egg donor or sperm donor. You also need to get consent. Okay? We don't just get a random person, because there are cases, that are in courts currently, and people are saying the child that the hospital gave me is not my child. If you find out now consent forms were not gotten from the clients. Okay? So how will the clinic prove beyond reasonable doubt that they had followed what ought to be? Is if the consent forms were given. Okay? So what is an informed consent? According to law, informed consent is voluntary. That means decisions taken is voluntary. That is, there's no force, there's no coercion. If the patients are informed, okay, they understand the risk and they understand the options, then the person who is giving them their diagnosis or giving them these options must be a competent person. Okay, and this consent should be gotten even before the procedure. So, for instance, a woman is going to have a CS. She's alive and well and strong. You should get a consent before you take her into the theater and remove the baby. Okay? Because we know that anything that has to do with surgery, there are risk. There must be risk. Okay? Yeah, so, all right. I'll also talk about when you have to do another time you will need legal guidance is if surrogacy becomes an option. Okay, so the way we do it at Mom Fertility Clinic, the surrogate mother has a contract and the surrogacy patient has their own contract. We don't combine contracts because of we want to keep the process anonymous. Okay, we don't want them to know each other, so we separate contracts. So there must be contracts, consents, everybody's contract is different depending on what you want. Okay. Then another time you need legal guidance is when you have now had your family is complete. Maybe you've had 2 different procedures which produce children. You have your embryos in the lab. You still have maybe 3 or 4 or 5 embryos. You have to give the clinic instructions on what to do next. What do we do with your embryo? So, according to international standards, there are 3 things to do with your embryos. Number 1 is to keep freezing the embryo. Number 2 is to discard, because you don't want your genetic information anywhere else. Or number 3, you want to donate, okay, either for research or you want to give it to another family, whatever you choose to do. So those are the 3 options available. And these are the times where you need legal guidance. And most importantly, confidentiality. The National Health Act speaks highly, and there has to be confidentiality. I know we are in the time of social media where everything is documented. Everybody is a journalist. Cameras are on our phones. But when it comes to this treatment, this journey, confidentiality must be respected. Thank you.
Thank you very much. So, I think there's something I got from what Barrister said here, that consent form is very important. So, whatever you're doing in assisted conception, you must have your consent form. Yours, that of the clinic or the specialist in charge of your program.
Yes, and you could even start in a certain direction. You could start your treatment in a certain direction. You could start your treatment in a certain... I don't know what's going on. Okay, so you could start your treatment in a certain direction, and maybe along the way, things don't go as planned. Okay. And maybe you're now moving from self-patient to donor. Okay. You should have another contract signed, because now things have changed. Okay, so each time there's a change, a new contract. Each time a change, each time there's a change, there should and must be a new contract.
Okay. Okay. Thank you very much, Barrister. Back to Dr. Charles. We know there are other options apart from the IUI, the IVF, and the ICSI. Please, can you give us other options a couple can use during this process?
Okay, yeah. She had mentioned about couples who have embryos. Yes. What should they do with their embryos? They can keep freezing. So, or donate for research or discard. Or donate to other couples who have need for embryo adoption. So, there is such a thing called embryo freezing.
Okay.
Yeah. There's embryo freezing. I mentioned, there is donor embryo. Okay, I mentioned donor egg,
Yes.
I mentioned donor sperm, and here is also donor embryo. So there are couple who are not able to, maybe they have both male factor that requires a donor sperm and also a female factor that requires a donor egg. When you are accepting both a sperm and an egg donation, it's called embryo donation.
Embryo donation.
Yes. So there's such an option. There are couples who probably can achieve pregnancy with an embryo donation program. Then another option that is available for people who are, maybe they are looking at many options like career building, they want to face professional development, they don't want to have a child. You know how pregnancy has a toll on you, pregnancy, childbirth, and nursing, okay, can take time. And this young lady wants to go and pursue a degree in Harvard, okay. She may want to freeze her eggs. So ovarian cryopreservation is an option that's available in assisted conception. Okay, she wants to freeze her egg, and that way she can put a pause on her biological clock while she pursue every other thing she wants to go after for. Then when she's ready, those frozen eggs will be used for her insemination with her future partner. And some ladies who the biological clock is ticking and Mr. Right is taking time to come, and Mr. Right, all right, is coming when she's in her 40, but she did egg freezing at her 30s, all right, maybe 35. When she's married at 40 and she wants to have children, those eggs are still 35 years old. The frozen eggs. The quality is still very good. She could get pregnant at 40 without needing those eggs. However, maybe in a few years down the line, ovarian reserve drops really badly and she wants to have more children. She can always fall back to those cryopreserved eggs. Some women go as far as preserving ovarian tissue, not just the egg. They take away most part of the ovary, freeze it, and when they are ready to get pregnant, that ovarian tissue is reinstalled. Is that the right word? Reattached surgically, okay, reimplanted, transplanted back into her ovary. Because it is her ovarian tissue, she's able to receive it back. And those very viable eggs, preserved eggs, are still there. Life begins again. Okay. So men also have this option of freezing their sperm, especially when they hit the age of 40. The male factor infertility begins to set in gradually. Women don't produce eggs. They have a finite number of eggs that they have been given to while they were in their mother's womb. As they mature in age, it begins to decline. All right? So for men, they produce eggs, they produce sperms. So men continue to produce sperm. However, when they hit the age of 40, things like low sperm count, low motility, low morphology. So in general, the quality of a man's sperm begins to drop. And he may want to, when he does an analysis and is told that there's an issue, he may want to freeze his sperm. What about a soldier who is just married to a young lady and is going to war? And and he probably is concerned about, having more children after his, if anything happens to him, anything can happen. The list is long. So he may want to freeze his sperm before going for that battle. Also, people who are cancer patients who are going to be undergoing some chemotherapy, radiotherapy, and all those things that may not selectively destroy the cancer cells, but may destroy good cells, may want to go for sperm or ovarian tissue cryopreservation or egg freezing as well. Okay, so it's just an option for people who want to postpone their fertility potentials into the future. Okay. The option is still long. We have surrogacy. We have surrogacy. Surrogacy is the process whereby a couple, married or partners, legally binded by a contract, are desirous of having a child or children, and they bring in a third party called a surrogate who is able to carry the pregnancy to term. Okay, so what happens here is that the woman may use her egg, or the husband may use his sperm with a donor egg, or as the case may be, but definitely it's not advisable to use gamete from the surrogate.
Okay.
Okay, so now this embryo is formed through in vitro fertilization, and the resultant embryo is transferred into the surrogate. The surrogate carries the pregnancy to term and delivers the baby, and the clinic hands it over back to the intending parents. Okay, that's surrogacy. It's an option. Some women who are born without a uterus, there's a condition known as Meyer Rokitansky Costa Hossa syndrome, where a woman is born without a womb.
Wow.
Right? That woman needs to have a child, and the only option is for another woman to carry the pregnancy for her. Okay, and there are some women who have entered, who have had surgeries and it has altered their uterus, or maybe from previous delivery she had a cesarean section that resulted into postpartum hemorrhage that made them to take away her uterus. She doesn't have a womb anymore. They had to save her life, but she wants to have more children. Surrogacy is an option for her. Okay. There are some women who they have Asherman syndrome. Probably they did some procedures, gynecological procedures prior, and the womb has now been healed together, okay, with adhesions, and she may not be able to carry a child. And some women, they may have unresponsive uterus to endometrial regeneration. The endometrium is still thin, regardless of the number of hormonal medication is called estrogen that you give to her to help her prepare her womb so that she can receive the baby. Despite those efforts, the endometrium remains thin. She could opt in for surrogacy. Okay. There are women who have high blood pressure that's not controlled, or heart disease, or cancer patients. They are undergoing cancer therapy, and they want to also have their children. The surrogacy becomes an option for these women. Right. So there are so many other autoimmune conditions that will make a woman not to be stable to carry a pregnancy through, because her life needs to continue. Yes. So surrogacy becomes an option for that woman.
Thank you so much, Doctor. I'm very sure we've gotten a lot of options for assisted conception now, right? Okay. Now, Barrister, I have a question for you. What risks happens when people ignore legal guidance during this process?
Yeah, thank you for that question. Legal guidance is very important. It's something you cannot overlook, okay? I'll give a backstory now. There's a lady who walked up to me. She happened to be a friend of mine way back in secondary school. She said, oh, she has a very close friend. They met in the UK and all of that. And someone who knows someone told her that there's someone who can help her get pregnant. He works in one center in Abuja, Cut the long story short, she came to Abuja, no documentation, no file opening, no contract signing. He was actually treating her in her hotel room, just giving her injections, just tell her, don't worry, everything. She was just a soft target for him, let me say. Of course, we know what the end of the entire thing was. She was negative. She was sad. She was in a very dark place, very bitter. But you need legal guidance so you don't get cheated of your funds, okay? Also, I would always advise fertility clinics and hospitals to ensure they draft, as part of their contract, an arbitration clause, okay? Because we don't have a legal framework. Trying to prove things in court might be tough. So why don't we do mediation? Why don't you do arbitration? Okay, and then they should train their in-house lawyers or get external providers, as to give them a legal contract that will contain an arbitration clause, neatly drafted. So when things come up, because problems all happen all the time. Am I am I lying? You know, disputes arise all the time. It could be from the patients, it could be from the hospital, it could even be from a surrogate. Oh yes, it could be from a surrogate. So disputes happen all the time. So we should also state when a dispute arises, how are we going to navigate it? How are we going to go around it? So you should not overlook the legal advice. I've also heard cases uh, of couples abroad who want to come home to do surrogacy, okay, and they do not get the process right. Babies are born and they cannot go and reunite with their families, either mostly in the UK anyway, or countries where surrogacy is prohibited. Okay, they didn't get proper guidance, and they are not able to reunite with their. So the children are actually stuck here in Nigeria. They can't go beyond the shores of Nigeria till, and even if they do, they won't go as their children. Do you understand? Like countries that are not, these things are not allowed to. So you need to be properly guided before you begin the journey. And then when you begin the journey, make sure you get the process right. That is why you need a lawyer to guide you through the process. What will immigration ask you for? What will be the embassies asking you for? What are the documents to have been in place before you even started the journey, so you don't run into problems? Parenthood is a big deal in the UK. In the UK, they will tell you the surrogate mother is the birth mother on the birth certificate, and that will not apply in Nigeria. After you have brought out plenty money, you now go and still do adoption order for a child that is actually yours, your husband's gamete and your own eggs, and they will tell you you are not the birth mother. The surrogate mother is the child, is the mother of the child. So these are some of the challenges we encounter on the job. But if you were properly guided, it will not be a challenge. Do you understand? Yes. So, yeah, those are areas that.
Thank
Yeah,
you so much
yeah.
for that. A
Thank
round of
you.
applause for her, please.
Thank you.
Okay, I think we have some questions online and I think on ground here, so questions can come in. Doctor, I have a question here from you, from a viewer online. Said, some couple ask about gender selection. When is gender selection medically advised, and when can couple be cautious?
Um, excuse me. Gender selection medically can be done for couple who have some genetic traits that they may not want to transfer to their male children. Okay, like hemophilia affect males. So, and if there's a family history of hemophilia in maybe the father, he may want to do a gender selection for a female child. Okay, Duchenne muscular dystrophy, Hunter X syndrome, there are so many of them. So people can do gender selection to treat medical conditions. However, in some climes like Africa, there is a premium placed on the male child for maintaining the lineage, the name, and all that. So some families, when they have had same children of the same sex, like the female, they may want to do gender selection to have male children. So that's Africa anyway. Some parts of the world do that, but it's not generally accepted in some countries. In the UK, Germany, Spain, and Turkey, France. The list is long. They don't allow, even in China, okay, because there are some issues that they think that people may now prefer to proliferate a particular gender. When you now start having more boys, where are the girls? So there's going to be balance in this society. While you are balancing your family or your desire, you're not balancing the society. So there are some cultural and also religious beliefs, ethical restrictions. You know, some religion don't believe that should be practiced. So, but medically, it's just to solve some genetic related issues that's tied to the male gender.
Okay, thank you, sir, for that answer. We have a question here from a viewer on Facebook. Said, please, I have been diagnosed with tubal blockage, hormonal imbalance, not getting pregnant. She said she needs help.
Well, you get pregnant with IVF, all
Okay.
right? So the hormonal imbalance, you would get to be stimulated with a high level of gonadotropins. Your hormonal flow will be controlled during IVF, all right? And being that you have a blocked fallopian tube, we don't during IVF your tube is not a requirement. And I think there was a last clause she mentioned.
Yes, high prolactin.
High prolactin that can be brought down with some medications. So with IVF, you can have help. So you are not helpless.
Okay, thank you so much for that, sir. I hope she gets this answer that she can get help. There's IVF as an option for her. We have another one here. Can hydrosapping cause miscarriage after doing IVF?
Okay, what is hydrosalpinx? Hydrosalpinx basically mean that there is fluid, okay, in the fallopian tube, and it's now making it bigger and obvious. All right, and you know, because the fluid is not going in and out, it's just there, it becomes a focus of infection. And that fallopian tube is connected to the uterus. That's how the natural process of fertilization and implantation passes through. So, for a woman who is pregnant, the hydrosalpinx can be a risk factor for miscarriage if that fluid is infected.
Okay.
Yeah. And for women who are trying to conceive, that can be a challenge to implantation because that fluid will come in, it could flush out the implant transferred embryo, or if it's infected, it can actually destroy the embryo.
Okay, thank you, sir.
Yeah. So the solution is just to take out the tubes
Okay.
or do a bilateral tubal ligation,
Okay.
disconnect it from the uterus, and she can do IVF and get pregnant.
Okay. Please, a round of applause for Doctor. We have another question here. Can a woman who is already in menopause have IVF?
Yes, you can conceive as long as you have a womb, right? Even if you are no longer menstruating, it's just because the hormones have that makes a woman to menstruate are down. Okay, now estrogen and progesterone replacement therapy, if they begin to give it to a menopausal woman, she'll begin to menstruate. All right. However, if after giving that hormone replacement therapy she doesn't menstruate, we can mimic menstruation by doing endometrial scratching.
Okay.
Okay, and begin to build up the endometrium for IVF. So for embryo transfer. So such a woman who is menopausal could benefit from a donor egg to have embryos for implantation.
Okay. Thank you, Doctor. I think this should be the last one for this segment. It says a patient whose diagnosis has been reviewed and is ought to use a donor egg, be it male or female, and refuses to use a donor and insists on using their own eggs, will it work? And it won't work. Will the clinic undergo this process or cancel the program?
Who is making the decision here? Is it the patient that wants to go ahead, or is the clinic that wants to go
The
ahead?
patient wants to go ahead with her own garments.
I think the patient has a right to explore their options.
Okay.
Okay. We doctors, we only will advise you, but the final decision is meant for the patient to. There are some people who have religious inclination that God has told them that they will get pregnant through their own egg. So you cannot, as a doctor, refuse to attend to such a patient. You give the patient the best care, all right, to express her faith in God, which is that God has told her her egg will be viable. So you do your best as a doctor, ensure that you allow the patient to go through the program, whilst you provide the other options. But the patient has a right to decide. So
Yes, so let me just add from the National Health Act, yeah? So you have the right to get your diagnosis, know your health status, you know. So any decision you are making is completely on you. Okay, so whether it results to a pregnancy or a healthy pregnancy, it's still on you. Even the counseling, they can't force you. We can't impose anything on you. It's completely your decision. If you insist on using yours, the hospital, the doctor, the counseling team, the nurses, no one will impose a donor gametes on you. Yes. Yeah.
Thank you so much, Ma. Thank you, sir. I think we've come to the end of this segment, and we've learned
Final
so
words.
much. I think I would want us to reiterate the options that doctor has given us for assisted conception. Can we say like 2 or 3 so we are sure we heard what doctor said? So please, someone from the audience should please give us some options. Okay, can someone give us the options that doctor had given for couple who are in need of assisted conception?
So he mentioned IUI. If you can't do IVF, you can also do IUI.
And he also mentioned fibro surgery for those people that.
We all got everything doctor has said and all barrister has said. So I would advise couples to please seek help before it's too late. You don't have to wait for 5 years, 3 years. Seek help when you know there's a need for it. Thank you very much.
yeah, I would like to just add here that there is no couple that is barren. If you have what it takes to carry a pregnancy, even at the age of 70 years old, you can have a child. Because God said that none shall be barren in the land. And when God said so, the knowledge of assisted conception was released but was not caught. Not until 1977, November, when Dr. Robert Edwards and Dr. Patrick Steptoe received the ability, the mental knowledge that they could take egg, fertilize it, and return it back to the woman's womb. Then the first IVF baby was born, Louis Brown. Now, that was the birth of modern assisted conception today. The only limitation for some of these couples is either lack of knowledge, and that's why we are doing A to Z of assisted conception, or funds, and that's why the Circle Mom Fertility Foundation is discounting IVF treatment for couples. And not only that, we also will join you spiritually in our Mothers and Fathers of Faith prayer platform. So we support you spiritually, and also we give you fertility counseling. You know, so it's a total package, and that's why the Cycle Mom Fertility Foundation bridges the gap in these homes so that they can have their children. Every home deserves a child.
So my final words would be that get your fertility test done quickly. Quick. If you know anyone, just speak up on time and get the test done. And then know that you are not alone on this journey, but get tested on time. Do something quickly because knowledge is available now. Yes. Do you understand? Yes. So yes, that's my final take home.
Okay. A round of applause for Doctor and Barrister. Okay, we have a performance by Vicky String. So please let's welcome Vicky String to the stage.
Good afternoon once again, ladies and gentlemen.
Uh, Thank you, Vicky Strings, for that performance. Was it lovely? How many of you enjoyed yourself? Okay. Uh, Today in our midst, we have a very wonderful couple. Okay, please, I want every one of us to go online to our Facebook page, Instagrams, YouTube, to please like, comment, share our live stream so people can see what we are doing here and they get the engagements, please. Thank you very much. Please, you can do that now. Please bring out your phone. Let's do that. Let's share whatever we are doing. Let's share the joy with everyone. They need to know about Circle Mom Fertility Foundation. Please, the link is up now. Please share on your Facebook, your WhatsApp status, your YouTube, Instagram, everywhere. Please post, share, comment, like. Okay, while we are doing that, there's a special couple in our midst today. They have been through this journey of assisted conception here at Mom Fertility Clinic. They are very important to us. Their journey is very special to us as a clinic. So please join me as we welcome Mr. and Mrs. Mbanugo with their bundle of joy. Please clap for them, please. Sorry, baby.
Welcome, Mr. and Mrs. Mbanugo. I believe um, you have been through the journey that we described earlier, navigating fertility as a couple. And today, you have your bundle of joy. You know, I'm sure he's still getting used to how to make a child calm down. It's gradual. It's okay. So, sir, we'd like you to tell us navigating fertility as a couple. How was this journey for you? How did you and your wife go through this journey? Because there are people out there and they are watching you. They want to hear you tell them your experience as a man. They will like the ma to tell them your experience. All right? So, we'd like to hear from you firsthand what it is like going through this journey of infertility and overcoming it. What were the strategies you deployed so that we can benefit? We'll have to excuse baby. Baby needs some special attention.
Thank you very much. My name is Paul Mbanugo. Pastor Charles and Pastor Mrs. Charles. I don't call you people doctor and lawyer. So I call both of you men and women of God. Thank you so much for your encouragement. You know, sometimes God allows you to pass through some stage in order to educate some people, other people. The journey is called John Cena, never give up.
Never give up. I hope you took that. Never give up. That's his journey.
That's my
Can
journey.
you throw more light to that?
You know, we have a wrestler called John Cena. Whenever they threw him up and down, at the end, he will win the match. True of us. So I want to advise every couple that is on this journey. One, go together with your wife. When two of you are going together, the journey will be very easy and smooth. And I have tried this IVF 4 times. At the 4th time, it clicked.
So you had IVF program 4 times.
Yes.
How did you handle the disappointments?
Well, I used to tell people in my own area of specialization that you cannot invest and lose in total. If you lose your money, you will gain experience. It's just like hitting a nail on the wall. Nobody comes to the wall and place a nail. No, you have to use your hammer first, second, third before the nail now penetrates. One good thing about IVF that I got to know, because each time we are coming here, I will pick my phone and be googling. Then the first time, have faith and trust your God that it will work. Don't give up. The first time we came here, I saw some people moving out with their babies. And I told my wife, very soon we'll go home with our own baby. She said, amen. The first one failed. I was somewhere. I was supposed to come with her, but I was somewhere. And she was like, when doctor called me, I said, doctor, do what you can do. I know we'll come to that point where others go with their babies. He said, I said, doctor, we've started this journey. And we must see to the end. That is why I say it's journey of never give up. Don't give up. Do you know the more you try this, the more chances you will get. Second one, I see difference. I told my wife there's progress. Let's go again. Third one, another 80% chances. I told my wife, I said, don't worry. We are going the 4th time. What good thing. Each time, and again, please, obey the advice of the doctor. It's not everything you will eat. All this chemical food, do away with them. Just listen to the man of God. Please don't mind me, I call him man of God. The 4th one, each one that I will make arrangement for Uber to come and go with us. Then the second one, the date was still ahead. When my wife came here, she came in here, they checked her. Doctor said that. Doctor now said that they are transferring the embryo immediately. She called me that they are transferring. I said, okay, I'm coming. Before I could get to that gate, everything has been done. I saw my wife going. I said, what happened? Not like any other day. This one is special one, is different. That is more chance has been created. More chance, more opportunity. Please, my dear people, and every other person, my advice for those who are looking for opportunity like this, keep on trying.
Never give up.
Never give up. Keep on trying. Never give up. How many times I said it? I'll repeat. Keep on trying. Never give up.
Okay.
You will definitely get yours. Thank you very much.
I know you said it like John Cena. That how did you feel as a Christian? Trusting God, and it seems like it didn't work. How did you handle your faith? How did you how was your prayer life? Did it drop? I know you've talked about the inspirational part. I'm talking about the spiritual part now of this journey. How did these disappointing those cycles that failed, how did it affect your faith towards God, and what did you do? Because someone needs to hear something about that.
Yes. Right from child, I so much believe in God. I don't believe God will disappoint me in any corner, in any journey of life. That's me. Sometimes if I'm talking, my wife will say, "Are you God?" I say, "Yes, God is in me, and he can never disappoint me." And we have this program every morning with Mom's Fertility, that every morning after our morning devotion, we'll start following that prayer line till the end. After which I will take my shower, then move to the office. They have a program they are doing every morning. And we are
Mothers
following
and
it.
Fathers of Faith.
Yes.
It's a
Mothers
prayer
and Fathers
network.
of Faith. Yes.
All right, Mrs. Zumbanugo. I would like you to tell us how many years you've been married. Let me help you with that. How many years you've been married, and tell us how was the IVF journey. Your husband mentioned that you went through IVF 4 times. That means you had injections, series of injections 4 different times. You had hormone flare up. And how was that experience for you?
Good evening, everybody. I'm glad to be in your midst this evening to share our experience in this journey of IVF. Indeed, it was not an easy journey. I got married at the age of 35 when I finished my youth service. And we tried. After 1 year, no show. 2 years, no show. 3 years, till now that it showed. We've been in that journey since 13 years. 13 years of our marriage. But one thing in the journey is that we did not give up. I married my man. I married my heart. If I am to marry again in my next world, he will still be my husband. Because he's a man of faith. He's a man of faith. Even though I do pray, I do this, but I must tell you that his faith is more than my own, sir. Yes. Because when we were passing through all this, at times I will frown face as a human being. He will say, "No, you don't have to do so." Our marriage is not all about having children. And he will always tell me that there are many ways of having children. There are many ways. Don't just bother yourself. Relax. Relax, be happy. So in this journey, I must encourage other people, my sisters and brothers, be always happy. Always be happy in the journey, because that helps a lot. It helps a lot. Just as he mentioned, faith. Faith is another critical thing inside it. You must have faith that you will get this. We showed faith doing our own. Another thing there is cooperation. Cooperate with your husband, though. Cooperate with. It's not a journey for one person alone. It's for 2 of you. We did it together. When we started coming here, anytime they give us the medication, or if I don't remember, he will be the one to remind me. See, oh, you have to take this. So they ask you not to eat sugar. Remember, oh, don't eat it. Oh. They ask you to eat so fruit. Oh. Remember, oh, then his own too, I will remind him. Even if he's rushing to go to work and forget his medication, I will tell him, see, oh, to the extent that some of the supplements was inside his bag, his office bag. Even if he forgets it at home, if he reach office, he will take his own. That was how we were cooperating to manage our situation at that time. It's very, very important. And be prayerful. Prayerful to build your faith. That prayer builds our faith. Just as he said, before we were having a Mothers of Faith and Fathers of Faith program in the morning. I don't used to miss it too. We wake up early. We used to have it by 5 o'clock. Early, that 5 o'clock, we'll just wake up, we'll have our prayer, we do everything before he will go to work. Because of our situation, I stopped whatever I was doing to just relax and get my medication. I was not doing anything. No. I had a very big shop before, but because of our situation, I said, let me relax and get what we are looking for. So he was the one running up and down, doing this and doing that. The only thing I do is just to assist him in the fish business. That was how we have been doing it. Then, God helped us. God helps us. We did the first one. That one failed. I cried truly. I really cried. But after that, I wiped my tears. I said, we should carry on again. The second one failed. I could remember again when I came. Okay, we did two in the other where doctor was before. Then we came here. No, we did one. Then we came here and did the three here. That the fourth one worked. So the second one failed. The third one, I could remember that third one, I cried and cried and cried. Barrister Victoria, in fact, you people should clap for her. She's an exceptional mom. Honestly, she's an encourager. Because I could remember how I felt it that day. And this our nurse then was still around, Nurse J. Two of them, they really encouraged me. I was crying and crying and crying. They called me and said, don't worry. Don't worry. She said, and I will not forget her word. Starting from day one, she will always tell me, if you fail this one, you are close to your evidence. If you maybe you fail this one, you are close to your evidence. If I come again and the thing fail, she will say, you are drawing closer to your evidence. I stick to that word. And I used it to work. I worked with the word. Even the last one I did before this one that worked for us, after her encouragement too, Nurse J carried me, JJ, and said, I want to walk you out so that you will not feel it. She walked me out up to the other side before I could get myself. With that encouragement, I was filled. With that encouragement, my faith was built. I really want to appreciate Barrister. I want to appreciate Pastor Dr. Charles. Because I used to call him Pastor. I used to call him Pastor. At times I will tell my people, this is my pastor, this is the wife. They say, I thought he's a doctor. I say, Doctor Pastor. He does everything. In fact, I've never seen this kind of people. I've never seen. They are encourager. I learned a lot from them. To my husband too, he was an encourager. Because I could remember the third one that we did. I was here crying. I called him because he did not come with us. He booked an Uber that brought me. So I just called him. Daddy, the thing has failed again. Oh. He said, start coming. I'm making fish for you. He was at home preparing fish. Maybe he was waiting to hear good news. But as I told him that I did not, don't worry, come. I'm preparing fish for you.
Wow. Never give up.
Getting home, the fish stew was ready. He has boiled rice. He has done everything. I relaxed and ate. So, with this, I want to encourage the men here. I want to encourage the men here. Always support your wife. No matter what. Even though we are the one carrying it too. Always support us. Then we, the women, let's support our husband too. Let's not give up. Let's not give up. Then the last one that worked here, the way God did it, in fact, I was shocked. God really used our pastor, our doctor. I just came for treatment, for scan. Immediately I came. I was outside there. He came out. Doctor came out and said, don't worry, I'm coming. I'll see you. Before you know it, he came and said, we are doing transfer today. I said, transfer? He said, the way I'm dressed. I wore skirt and blouse that was even tight. If I'm coming for that, I used to wear loose dress. But he said, we are doing it. We want to shame the devil today. That's why I call him pastor. He said, we want to shame the devil. We want to surprise the devil.
Unawares.
That was how he did it too. And me too, I believed it. Immediately, we did the transfer. After doing the transfer, all other transfer we will do, Uber will carry me. Or my husband's director will send his car, her car. They will carry me. They won't even run too much on the road. They will just be carrying me like an egg to my house. They worked for us. God of mercy. It was a surprise package. Immediately I finished. From here, I jumped to Apo. From Apo, I entered to Nyanya. From Nyanya, I entered to my junction. From my junction, I climbed Okada to my place. I'm telling you. Then I got home. We started staying like that 2 weeks that we used to stay. But it wasn't like other ones. I did not even bother myself all that much. Only that I stick to doctor's instruction. I followed everything. What they said I should eat, I ate. What they asked me to do, I did. And the results came out positive.
Where is our bundle of joy?
In fact.
And the result is here. Paul Jr. But the mother ate a lot of avocado, instructed by the pastor. A lot of avocado.
Thank you very much, sir.
Beer.
You know, I'm so happy you are the real man because of how you supported, encouraged her.
Thank you.
But did you experience societal pressure? What did you experience? Did people call you names? Were there times you are the one foiling her encouragement? Were there times you were deflated in a way, being discouraged out there? Doctor, and how did you handle it?
Doctor, did I hear you say societal what?
Pressure.
Pressure plus victimization. Stigmatization. So let me tell you something. One day, a very good friend of mine told me, said, what are you doing? Go and marry another wife. You are just staying with this woman for many years. Look at your younger ones. Their children are in secondary school. What are you doing with this woman? I said, there is time for everything. If we are dying, we die together. If we are living, we live together. One day I travel home I was meant to spend 2 weeks because I'm on leave. They surrounded me, relations. Oga, tell us the condition of your wife. I said, my wife is fine. We want to know her condition. How many years now without any, you don't want us to celebrate you? Or I said, okay, I'm the one marrying her. It's not you people. You are only supporting me. Don't worry, tomorrow I will tell you how far we have gone. That night I packed my load and hit Abuja. Because I don't want to hear such stories. I went for a meeting with my very good friend. Instead of introducing ourselves, this is who you are, I'm so and so person, this is what I do for a living. Everybody knows me, I'm a local person, a farmer, ordinary fish farmer and civil servant. Instead of me to introduce instead of everybody to, he say, my name is so and so person, I'm married, I have 3 children. This one say, my name is so and so person, because they knew my condition. It comes to me, I say, my name is Paul, and I'm a civil servant. And then when I go out there, I told them I'm a grandfather. Am I not a grandfather? I train other people's children. They are my children. Some of them are gotten married. Some of them has 3 kids. Am I not a grandfather? Must he be my own biological son? The great thing has happened in my life through Dr. Pastor Charles. God bless you. Thank you so much.
Thank you very much. Any final words for couples out there that just want to be like you? I know you mentioned something like don't give up. Do you have any other thing you would like to
Yes,
tell
I
us?
want to advise the couple to always be together. Have a faith. Don't listen to side talk. Your friend may try to insert something in your life, not in your mind, to destroy your home. Please stick to your faith. Don't give up.
I still want to chip in something to the couples too. Because during our time too, I didn't joke with the service unto God. I did not joke. And did not say because of my condition, I will not